Hi, I'm Dr. Ross Taubman, and I'm the president of PICA, the Podiatry Insurance Company of America. I'm going to talk with you today about navigating healthcare in a digital world. You know, all of you have grown up in a world where you've had social media, electronic devices, cell phones, cameras at your disposal every day, and it's an amazing part of how you communicate with each other. At the same time, those things present risk to you if you decide to become a healthcare provider. And today I want to talk to you about the top 4 things that I want you to think about as it relates to social media and an electronic world. Number 1, the choices that you make now are going to follow you for the rest of your life. Now, I don't say that to scare you. I say that as you grow up and as you do fun things and you record them through your social media and you put it out to your friends, that's going to follow you. It's never going to go away. And someday down the road, someone is going to see your social media imprint and they're going to judge you based upon what you did many years ago when you're younger. One of the areas in a common way that I can talk about that is think about the fact that you might get a tattoo as a young person. A lot of you think tattoos are cool and you get them and you want to show your friends and you want to take pictures of them and send them to your friends, and I think that's all fine. However, think about the implications. So employers down the road will decide whether or not your tattoo is actually cool because they're worried about their customer base. Think about Disney. Have you ever been to Disneyland or Disney World in the heat of the summer? It's 100 degrees outside, and that guy at the popcorn stand is fishing out popcorn out of the machine in long sleeves. Well, the reason he's doing that is because he's got tattoos on, and Disney has a policy that there can be no visible tattoos. So as you think about social media and you take pictures of that tattoo and you put it out there, that social media is going to follow you forever. It's never going away. You're stuck with it. So if it's not something you want the rest of the world to see for the rest of your life, then consider the impact that it may have as you get older. The second concept that I want to talk about is how a lack of professionalism in social media can impact your professional career down the road. And let's talk about this. As a healthcare provider, you are expected to have a certain level of professionalism. You are an icon in the community. People look up to healthcare providers. And if there's anything in your social media footprint that takes away or detracts from that persona, it's something that you should consider. So the way that you deal with that is to keep a separate personal from professional social media footprint. So think about some examples. First example that comes to mind is you shouldn't have sexually explicit pictures or sexually suggestive pictures on your social media footprint that would cross over to your professional footprint. Keep those separate. The same goes for alcohol. If you're somebody who's drinking alcohol, you don't want to make that part of your professional footprint because that will detract from the way people think about you. And the last area that I would suggest is politics. Politics are very personal for all of us, and we all think we're right. My view's right and your view's wrong. Well, in reality, they're choices. And so politics being a controversial topic, keep them separate. They have no place in a professional footprint, and if you want it to be part of your personal footprint, that's fine, but make sure those two things are separate. So the third concept that I want to talk about is the blurring of boundaries that healthcare providers have with their patients. So you know, all of you are on social media and you have lots of friends on social media, and part of the social media impact is to see how many people you can follow or follow you. Well, that's not a particularly good thing to do as a healthcare provider, because as we blur that conversation between the doctor and the patient, it brings into call one of the central issues that we worry about as a malpractice provider. Because you know, the medical record is how we defend you in a malpractice lawsuit. And lawyers will tell us if it's not in the record, it didn't happen. So if you have this relationship going on with your patients that is outside of the medical record, whether it's through text or social media or whatever way that you want to do that, it creates some intricate problems because that evidence in a malpractice suit needs to be part of the medical record and won't be if you don't protect the sanctity of the medical record. So the advice that we give you is do not friend your patients, do not communicate with them electronically through social media unless you have a way of getting all that information into the medical record, because that's how we're going to protect you should there be a lawsuit. So the fourth concept that I want to put out for you to consider is how you use social media in your practice to promote yourself and to promote the things that you do in your practice. So let's say you're the person who invented this new surgical procedure. Nobody's ever done that before, and you want to tell the world about it through your experiences of how you treated a patient. Well, there are federal laws that say that you must protect the patient's personal health information, and you cannot divulge that without their permission. So think about, you've got this new surgical procedure we just talked about, and you put it out there, and you didn't get consent from the patient to put it out there. You're potentially violating federal law. And here's the key. It doesn't have to have their name in the promotion that you put out there, or their age, or some other identifier. If that person reasonably could figure out that you're talking about them, that might be consideration that you violated the privacy laws related to personal health information. So be careful when you use social media as a promotion tool, because you have responsibility to the federal statutes to protect the patient's privacy. I want to conclude my remarks with this quote from Warren Buffett. It takes 20 years to build a reputation and 5 minutes to ruin it. If you think about that, you'll do things differently. Thanks for the opportunity to speak with you. I hope that what I've said has been informative, and I hope that you find ways to use social media in a positive way as you embark on your careers as a healthcare professional. Thank you.